in the countries that are not actually of high income. And this, all of these areas of disease, the one that's negative here, there's a better health in the lower income countries is mental health, but the other ones had an excess of actually ill health. This is a factor to be included, right? So we see the mental health is also very important, and this is just a joke. Yes, this is the excess of burden of disease in total, meaning that in the countries, the countries that have high-income countries, 50% of the burden of the disease of low-income countries is in excess of what they would have if they had the risk and the burden of the disease in these areas of disease compared to the high-income countries. This is the excess of risk in the other regions. I would like to talk about something which is better understandable, actually, with due respect to the diplomats and due respect for the society in general and for us, too. Burden of disease, the disease is a concept, and it's an obscure, a dark concept that has many interpretations and discussions. But everybody agrees on the fact that the years of life expectancy years, and also, after many briefings to politicians in Europe, I understand the deaths, the excess mortality, the children or adults that die, and they die due to concrete cause before time, and caused by something that can be preventable or avoidable. Let's talk about this concrete term now. This is the evolution in the 20-year time frame of the life expectancy in the different regions in the world. We have improved in the last, let's say, 20 years. The life expectancy in the whole region has been increasing progressively. Even though we were to see 50 years in the evolution against the statistics that we have, the life expectancy has increased constantly in the generation of our parents, our generation, and starting perhaps in our grandparents. We don't know what's going to happen with our children, but we see an increase as never before in mankind. Here, the generation which is most privileged of having increased of enjoyment of life, more or less between let's say every 4 or 5 days of life increases 1 day in life expectancy, meaning that a child that is going to be born today will have a life expectancy 1 day less the one that will be born on Friday. This is a concept that humanity can feel proud of the fact that advancement of the living conditions have improved, housing, nutrition, access to health services, treatment of certain infections especially, and allow us to have a better life expectancy. But still, the life expectancy is hard to be compared among the countries. I would like to know the difference of resources actually mean or not human deaths. I think this is the data that actually can be clearly understood by this society and their representatives. I did it with the indicators that we have at hand, that within the limits we have are more reliable and more constantly found in the 20 years, which is mortality of children under 5 and adult mortality, including the adults from 15 and 60 years of age. You see the evolution of these mortality rates in this time frame, and compare this again to higher income region and the rest. And it's interesting to see that in child mortality, we see a drop in the regions constantly, but the high income region saw a drop, but let's say is going to biological limits. We have under mortality from 8 to 5.8 per thousand in children below 5 years of age. That goes to genetic problems that have to do actually with problems that science cannot yet resolve. And therefore, here we can see the difference between the low-income and high-income countries. The difference found in mortality, children below 5 years of age has been dropping, and it's shown in blue. Mortality rate actually has been dropping. We saw that there had been a certain progress in the number 4 Millennium Development Goal. Actually, adult mortality is much more complex. We see from the 90s to the 2000s, the adult mortality has increased in the low-income countries, in the high-income countries too. Almost all attribute this to AIDS in the 90s, and this due to the collapse of the Soviet Union. But there were variations to be found here. But then it seems that they have dropped in the last decade once again. It's important to state here what is the differentiation, equity. Actually, we have good news in terms of mean, but the evolution actually has decreased, and this is the mortality of adults through these decades. But this, once again, are rates. They're not easily understandable. Let's go to the death toll, and we're going to see the unequal or the unfair distribution of resources. When we apply this difference in terms of mortality rate to the demographic structure of these peoples, we have a total of deaths that would have never occurred provided that the world would have the same indicators that the high-income region. This total of death is of 20 million. There's no much change, but this is the distribution in adults and child in different regions. Also, it's harder to interpret the ones of the regions because the regions have different type of total population. But the most important is that 20 million of people die on a yearly basis, constantly, actually rounding at figures, not by malaria or pneumonia or not by accidents or by other problems, by injustice in terms of distribution of resources in the world. This is the key factor. But the worst of this analysis would be to see that we could say, well, 20 million constant with a population that grows in the world. Perhaps we are not going too bad. But we see demographics in the world. We see also the different countries. The population of the world is younger now than 20 years ago. The number of deaths in the world is 60 million, and from the year 90s until today, there are not big variations. Therefore, we can say 1 out of 3 people that die in the world die because of injustice in terms of human or resource distribution, because we two-thirds with the distribution, an equal distribution of resources among countries, and the unequal distribution within countries, also we see 1/3. Let's say, in a nutshell, simplistically speaking, we could even argue that we have an increase of life expectancy, unprecedented life expectancy in the history of mankind, but the inequality of global health has been stagnated in the last 20 years. That inequality is translated in at least 20 million deaths, in excess deaths that are premature deaths. 20 million actually in excess die due to this inequality in terms of resources, and this presupposes that 30% of deaths in the world, and national inequalities contribute even to 1/3 of this global health gap. then what can we do? What is the approach? Actually, this painting that you know might represent the equality, everybody advancing at the same time. This is criticized because, let's say, in an egalitarian society, there is no advancement, which is a paradigm, actually,